A very good morning to all. Today I'm going to share with you how technology empower rehabilitation for the future. This is me myself 10 years ago when I was a student like you in the university. I joined a robotic club to learn how to build a robot from scratch. And this is one of the most complex robots I have ever built. There, I learned a lot of skill about building robots in preparing for a robotic competition. We worked very hard for that. And I still remember how hard it is. There's one day, I tried to fix a screw on the robot, and I was too tired, and then I fall asleep. And guess what? The next day morning, I'm still holding the same position, and I have to continue screwing it. Until that level of extent we go in order to build the best robot we can to win the competition. That year, we won the Best Design Award in Egypt, representing Malaysia. And later on, we won the World Invention Award in British Invention Show. I'm very happy getting the award coming back to Malaysia. But then I start to ask myself, why should I struggle so hard to learn all this skill? Is it just to win a competition or getting an award? And I asked around my friend, and they say, with the award and experience, you can get a good CV, and then you can get a good job. But for me, there should be something more than just to get a good job. Because what we have done should be more than just a job. And many things have changed after I visited the stroke center by chance. This is the first time I see stroke patient in my lifetime, where I can see the patient working very hard to recover from stroke. And the left side picture you can see is the first time really I see the stroke patient. And the side is the therapist where helping the patient, guiding him how to even walking in step patiently with effort. In front of him is his wife, the caregiver. And I look around what is the tools they use to train and recover from stroke. And I realize most of the tools they use are quite basic. For example, the gym ball, the shoulder wheel that they modified through bicycle to train the shoulder, and the shoulder slider like this in order to strengthen the arm. Then I wonder why they did not use advanced technology, and I asked them, and they tell me it's too expensive, we cannot afford it. And that actually struck me, because we have learned so much in university about technologies, but what we have seen in our society, we apply so little to help our society. And that is where I found my answer, to use the skill I learned from university and help them to recover from stroke effectively with technology. Can you imagine one day your loved ones are not able to move half of the body? How would you feel? And what will you do? This happened to me. My dad got a stroke a few years ago. 2 times of stroke within just a few days. That time, I feel panicked, I feel sad, and I feel helpless. But there's one thing I know, that I want to give my best for his recovery. So the key of stroke rehabilitation is called neuroplasticity. It's where the ability of our brain structure to relearn and reorganize itself through repetitive training and practice. So this is the theory where how we learn since we are born. For example, writing, walking, ride a bike, driving, and even mathematics. The same things happens, we use this in rehabilitation to relearn the function that we have lost after the injury. So why do we need to use rehabilitation technology? I want to give you a simple scenario. Let's say we want to move from point A to point B. How much time do you think we need to travel from point A to point B, from Johor to KL? The first choice probably we can do walk. It takes about 3 days, 72 hours around. The second choice we can do bike, 4.5 hours. Well, if you have a car, we can drive, right? 3.5 hours. Well, if you want even faster, we can take the flight. It's only 55 minutes. So what I'm trying to say is, the better we can utilize the technology, the faster we can reach the recovery destination for the patient. So this is how it looks like on a conventional hand recovery process, where I'm going through with my dad. So normally we will start with stretching exercise, because getting stroke, not able to move the hand slowly, the muscle will become stiff. We have to do stretching a lot to relax the muscle. And slowly, we move the hand passively so that they learn how to move the hand again. And once they start to progress, we then guide them to do some functional exercise, for example, pick and place like shown in the videos. And we call it as active assisted training. It looks quite simple here, but it takes not 1, 2 times, it's hundreds, thousands of times. If you are lucky, it takes 1 to 2 months, but normally people take years and even more than 10 years to do that. And you can see here, it requires a lot of human assistance through the trainings. And that is why rehabilitation in stroke is so difficult. That's why we need robotic technology to help us to expedite the recovery. This is an example of hand robotic trainings to use in stroke rehab. We try to mimic and assist along the journey. From the first picture, you can see the videos, compression therapy, we use the air compression to give a massage for the patient to relax their muscle in a consistent way, like the stretching effect. And then we wear the robot, the patient can move the hand passively assisted by the robot. Not 1, 2 times, but thousands of times. And then slowly when they improve, we call it active assisted, where they use the good side of the hand to control the weak side of the hand, to do self-engaging activity to relearn even faster. And then slowly when they start to move, we do strengthening activity by resisting the movement of the robot. So with robot, last time with assistance of the human, it takes probably 30 to 60 times within an hour of repetition we can do. But with robot, we can easily do thousands of repetitions within just an hour. And that is the huge impact we can use for the patient using technology. So I'm going to share with you some of the case study, how we apply hand robot technology with patient. So this is a case study where you can see 50 years old lady, 4 years post-stroke. The first time when we meet her, the hand is very stiff. Just now, like I mentioned, we need to do a lot of stretching, right? If there is no assistance, most of our patients, will be maintained in a very stiff manner. So we teach them the exercise together with robotic exercise. After a series of trainings, slowly they start to see the finger move again. And she's so happy because that is the first time her fingers start to move again after so many years. This is a case study too, where a 70 years old man, 1 year post-stroke. The first video shows the first time you can see after the post-stroke, the hand is not able to move much. And then we give the trainings with the robot together with compassionate trainings. And with sufficient trainings and methods, slowly we can start to see the progress of the improvement of the hand. And you can see the video, they can start to open and close. And then we further improve the training by strengthening the shoulder and elbow so that we can transfer that skill for functional tasks. And that's how they learn to eat again. Last time, it takes years to relearn how to eat. But with robotic technology, we can speed up within 2 to 3 months in order to see the effect. And not only we can help the adult or elderly, but even children. So this is a third case study where a 4-year-old boy have a 1 month post-stroke. post-injury. The left side, you can see the little finger not able to do much. Right? You can see the little finger. Right. Then we give the training combination with robotics. So this is an example of the video. And they do daily activities of trainings. And after a few weeks, we can see the impact whereby the little fingers start to move back again. So that is how we can utilize the robotic technology to make an impact for the patient in recovery. So you can ask, what if the patient are staying at remote area, right? If they do not have the access to therapies or rehabilitation services. With technology, we can bring the therapies for them. Example, this is some of the case illustration whereby we can use the virtual technology, bring the therapies for the patient, provide guidance one-to-one for the patient, anywhere, anytime they are. Especially this is where during COVID time. And we're seeing the impact is almost the same meeting them physically. So that's how we can use the technologies to help different patients in a different place. May I know how many of you can drive? There's a lot of us need to learn how to drive because we rely on this skill to work, to study, and move to place. And this is the most asked question by the patient to the therapist. When can I drive back? It looks like a simple question, but I can tell you the answer is very difficult. Because driving skill is a very complex task, require cognitive, upper limb motor control and lower limb motor control happen at the same time. So, because driving and practicing on the real car is dangerous not only for the patient but also for the therapist. That's why conventionally it takes a long time for us to train back how to drive again. But with technology, we can bring the car for the patient using driving simulation technology. This is an example how we use the technology for the patient. And you can see the patient is holding the rear wheel. There's a wiper, there's a horn, there's a screen to illustrate the environment. The advantage of the driving simulator is where we can bring different scenarios for the patient. Example, raining, nighttime driving, car following, and many other tasks that we need in order to use in the real world driving. And more importantly, they can learn how to drive safely. I'm going to share with you this case study whereby this is a stroke patient learning how to drive with a simulation. So you can see he tried to move the steering and control the gear, not so in synchronized manner, but he tried to do his best to relearn. So after a series of training and tests, he getting the confidence and the skill back to drive. And after the test, we bring him, transfer the skill to the real car, and you can see he's able to drive back again safely. So rehabilitation is boring and tiring, we understand that. That's the reason why we use gamified technology in rehabilitation. So the left side you can see the gamification of balancing trainings. We use the balancing board whereby there's a sensor built in and they can interact with the games on the visual screen to learn how to train back their balance again while playing the game in a progressive manner. While the right side you can see we gamify the arm trainings because normally in therapies it's very hard for the patient to train the hand because it's very tiring and not engaging. And that's why therapists spend a lot of time to encourage the patient just to move their hand. But with gamification of technology, patients are not able to stop playing it. While without them realizing it, they are improving their upper limb function. And that is how technology can help to make the change. With the growth of artificial intelligence, now our camera can even track the movement of the patient seamlessly. From the video on the left side, you can see this is a real time where the camera is able to track the hand of the patient. And the right side, you can see we assess the knee function, the range of movement of the hand, in order to know what is their current condition. So you may ask, why should we assess the range of movement for them? Because every patient is unique. Because of the brain damage is different for every patient. And that's why training has to be different for every patient. That also is one of the reasons why stroke rehabilitation is one of the most challenging fields in rehabilitation. But with fast assessment and right diagnostic, we can understand the stage of the recovery for every patient immediately and provide precise training for the patient so that they can improve in a faster way. And this is just some of the technology that we can use, and there are many more. With the help of the technology, I'm pleased to share that my dad able to recover 80% of his function. And now, he's even able to drive the bicycle by himself. And this is how technology can empower the future of rehabilitation. Thank you.